Welcome back to this Healing Habits Homeopathic Daily Journey. So, Dr. Gitesh is just joining in 2 minutes. So, we'll start till then. So, I'm having a case. We were discussing about the case, and this case is of chronic bronchitis, middle aged man, and he was having habit of chronic smoking. And because of smoking, with years together, he developed chronic cough. So he would get cough in the morning. With that, there will be discharge, expectoration, yellowish expectoration, and many times he would develop with that cough, the fever, coryza, throat pain, and he will be down for few days. And with that cough, he would say, "I'm having lot of throat pain, severe throat pain, and especially the pain is kind of stitching pain. Something is poking there." And he would have cough, especially because of he would feel some irritation in throat. I feel some irritation, and then I start coughing. That cough, with that he will be having coryza, sometimes fever, and usually, as I told you, in the morning it will get aggravated. He said, "I'm having this tendency of catching cold previously also, and whenever there is change of weather, especially from warm to cold, so I will get affected by cold weather easily, and I would catch cold, I would have fever. So whenever I will get exposed to cold air, whenever I eat cold food, ice cream, cold drink, draft of air, or if I sleep under the fan, that draft of air would also affect me." So basically, he said, "I cannot tolerate cold air, draft of air, and whenever I'm having fever or coryza, especially severe fever, I would feel very cold. I would not tolerate any kind of air. So what I want to do, I will close the windows and door, I will switch off the fan, and I will sleep with the blanket." So because of that, room become hot and warm, and I develop lot of perspiration. But still, I will cover the blanket. Still, I will take the blanket, and I feel better by that. When room becomes stuffy, when room becomes little humid, that in that situation, I will be better. This is what he explained me, how what he does when he has fever, coldness. Uh, then we were talking. Then I asked him about his nature. So his wife was also accompanying him. So he said, "Doctor, my nature, I get easily angry." And very interesting incidents he narrated. So he said, "I went to my hometown, and there were some dispute with my uncles on the property, and the discussion became turned into argument, and that argument became, right, like a quarrel, fight, heated argument. And I became so excited, so angry, I started hitting one of my cousin. So I started hitting him. 4 5 people came, they were pulling me, and I was like, I was very angry. I wanted to hit him very badly. So 4 5 people took me, pulled me, and they locked me in a room. But I was so excited, I was so angry. I broke the door open and I came out. So this much anger I get when I get angry or very excited. So this was one incident, and this is how usually my anger is, he told me. And wife also said yes, he is very angry. Wife also narrated one incident when he was eating. Wife said he eats very fast, he usually very restless. He's very restless, he eats very fast. He was eating and continuously watches mobile when eating. So once I said, "Why you're watching mobile? Keep that mobile aside and eat properly." Just one sentence, and he got so angry. He threw the mobile phone. He has broken it, and he made it sure that it will be broken in pieces. Wife said even SIM card also he broke in pieces. So this much he gets angry immediately and he throws the thing, breaks the things. And sometimes at times he gets angry, he will abuse or he will hit me also. So this kind of nature she said. And one more thing, that very interesting thing she said, once he goes to one place, suppose he eats pani puri at one place, he will not go there again to eat pani puri, he will search some other place, or he will go somewhere else. So he will say, no, we'll go to the some will search some new place to hang out, new place to go out, new place to eat. So he also keep changing the things. He will not go to the same place again. So this was in short what his wife also shared. One more thing he said, doctor, I cannot bear cold air, especially my ears. I want to be ear closed, head and closed, wrapped ear closed. So this much sensitivity he has for cold air. So after the case, when I was analyzing the case, I repertorized also. I realized that at physical level, we could definitely see the sensitivity to cold air. The slightest draft from a fan, he could not bear. Cold air to ear, he could not bear. And that develops the cold coryza cough, and as the background smoking habit was there, which was the cause for his chronic bronchitis. But he's very sensitive to cold air. And at the mind level also, I could see the dispute with uncles is the one thing, but wife saying only keep mobile aside and he's getting angry and throwing the phone, I could see there also he's reacting maybe out of proportion. So what I could see, that at the mind level also, by the smallest stimulus he is getting excited, he is getting angry at the trifles. So I could see the sensitivity at physical level as well as mind level. And we all know that hipar is extremely sensitive for cold air, as well as very aggressive, very destructive kind of medicine. We all know hipar is from syphilitic miasm also, and hipar get emulated by damp cold weather, by warm weather, by warmth of the room. So I started with hipar, and he beautifully responded to hipar. So this was my the important learning. What I wanted to share is, we all know that hepar is very aggressive, destructive, wants to kill others, very impulsive, right? Impulsively act. But the change, he will not go to the same place again, was something new for me in hepar. And when I read hepar afterwards, especially in Kent, when I was reading, I got very interesting symptom that Kent says he is very hard to get along, and nothing pleases him. He desires a change in person and thing and surrounding, and each new surrounding or a person or a thing displeases him, makes him irritated again. So this change, always wanted to change in environment, always wanted to change in things. That also one thing new I learned from this case. So I thought this is a good case to share.
Lovely, lovely. This symptom I did not knew, Dr. Shardul. It is interesting to know. I would like to just add to your case that I was treating one girl. When I first saw her, I gave her sulfur last year, and she did reasonably well. Around the same time, I started her treatment in February, March. And that 6, 7 months, she did well with sulfur in terms of her recurrent cold and cough. But since this year started, January and February, her problem of recurrent cold cough, and if I remember correctly, she also had some wheezing whenever she used to get this cold and cough, and she had to miss the school for a week or 10 days.
Hmm.
I kind of repertorized her symptoms. I did 2, 3 retakes. I had given her arsenic as well. Then the mother said that after the cough, she used to have burps. Because of that, I gave Viratram. Nothing happened. And then, of course, my go to thing always is to repertorize using the therapeutic pocketbook. In that, arsenic and viratrum were already given, but this symptom was very prominent. That the mother said that even if she is exposed to slightest draft of air, she is sure to get this attack of cold and cough.
Mm.
And in my repertorization, the third remedy that was coming up was Hepar self. So the totality of Hepar self, like whenever she used to laugh, whenever she used to run, or whenever she used to have some, this what is called as Gola or Pepsi Cola, something, which is made up of ice and some
Ice Gola.
rustling flavor. Yeah. She used to land up with this problem and miss school, and I had to give the certificate and all that. So parents were really troubled, and I was also not finding an answer. But I saw hip herself coming up, and then this symptom that the mother said that even a slightest draft she is exposed to, then she lands up with this trouble. I verified these symptoms in quite a few cases requiring hip herself successfully. So this symptom is a pure gem. In terms of her temperament, I did not see any violence or impulsiveness, or in fact, whenever I used to see her, I felt she's more mild and yielding and all that. But since February, I have seen that I have not heard any acute episodes from the point that I have given Hiparcel. So I just wanted to emphasize your symptom that slightest change or exposure to cold air aggravating the respiratory problems is a very sure shot symptom of Hiparcel if the other symptoms of the case agree.
Hmm.
Yes. So just few thoughts from my side. Firstly, I think all of us know cold air, cold draft. But since I first started to know this remedy, I thought one very important location that Heparcel seems to be having a affinity for is the throat. Throat pain from cold, very, very, first remedy to be thought of because um, I think cold sensitivity, we have other remedies also, like Nux vomica is there. In fact, it is said that Nux is almost as chilly as Hiparcel.
Right.
The difference is that Nux will have more sort of sneezing, cold, fevers, um, and Hipar will have more to do with upper respiratory throat infection kind of things. So I thought I will just add that. And also, um, just to pick up on Dr. Shardul's case, see, what he said is that the patient developed or reacted in a very violent way in a incidence where there was sort of a property dispute. No?
Yes.
So, especially property disputes, money dispute, property dispute, savings dispute, this is very classical of fourth row of periodic table, and Hepar sulf is actually calcarea sulf only. It has a lot of calcarea in it, and it is burnt calcarea sulf. So appreciation, desire
Up
for,
to 1500 degrees,
yes, it is burnt. Yes.
very high degrees. So that is also probably, very, I remember it
Fire.
that way. कि
Yes.
वो बनाते वक्त it is so high degrees that this patient becomes so chilly.
Huh. That could be one. But even if we look at the rubrics of violence of Hipar self,
Hmm.
it has a lot to do with fire. You
Yes.
know,
Hmm.
throw,
Yes.
throws things into fire, will try to
Stand to.
commit suicide by going into fire. So the
Hmm.
fire element is very big in Hipar self. If you look at all the rubrics of violence, the fire element is coming up
Yes.
very strongly. Wants to set things on fire, wants to commit suicide by fire, wants to kill people impulsively by, setting them on
Right.
fire.
Throwing them
And
on fire.
just one more thing is, in fact, I remember one case, it was a psychiatric case, and that child was, he had schizophrenia, and uh, what the father used to tell is he will wake up in the morning and he will say that there is something there in our bedroom and some people are coming, they are trying to do something, so I have to prevent them from coming inside our house. So he will go on the street, he will collect all the paper that is lying, and he will sit there, and whole day he will keep burning that paper by setting that paper on fire. And he somehow believed that this will prevent someone to come inside my house and attack my house and harm me and not let me sleep in the night, and they are very dangerous, they are very harmful. That is what he really believed. And that case I had given Hepar self initially, but he had aggravated. Father said, what remedy you gave? The child has got aggravated by this. And then I thought, what happened? And then I realized that violence was missing in that case. He had a lot of fear of this set things on fire, etc. Then I read one more symptom, that is calcarea carb, which is talks only about fire, murder,
Fire, rat.
and
Right.
rats. No?
Hmm.
So then I started seeing, then I understood, acha, there's no violence, there's the carbon element and all of that. And I gave calcarea carb instead of Hipar self, and he did very well on calcarea carb. So,
Calcarea Club has that delusion that somebody's behind.
so maybe that also matched. So
Hmm.
that was one more thing I thought I will add. Firstly, the property. I think property dispute, money dispute, very important for row 4 remedies.
Yeah.
Chili, Nux vomica, um, Calcarea sulf. And one last thing I remember, I have a case who comes to me almost since 3.5 years now. He's very regular. Every month he comes for follow-up. So, so, and when he came to me first time, he came to me with complaints of acidity, and he used to have pain in left chest, pain in left abdomen, pain in left arm, pain in left leg. And like my favorite thing nowadays is I will always look at how the complaint started rather than only the presenting complaint. So I kept digging because my first impression was this must be some left-sided remedy. No, so much of left-sidedness, left arm, left chest, left abdomen, all three, four different locations, left-sided. So I thought, it should be some left-sided remedy. But then as I started finding how the complaints began, he said that it all began after I had one cold. And I'm very sensitive to cold. And along with that cold, I used to develop pus boils.
Hmm.
And sensitive to cold, I was thinking which remedies, which remedy. And then when he said pus boils, then I, related it with Hepar self. And then I realized he was so anxious about all this because he had done so many investigations. As I told you, he comes to me regularly every single month. And
Hmm.
even now he comes only to get assurance.
Hmm.
Doctor, the remedy you have given, no, it has reduced all my symptoms. But I stop remedy, 10-15 days, I am fine. But then symptoms start coming. Now I am having little bit of burning urination. What do you think, doctor? Anything serious happened to me? I said, kuch nahi, nothing happened. You'll get better. By tomorrow, you'll be better. I'll give remedy. Matlab, I can see that, satisfaction in his face when he hears that doctor has said nothing has happened to me, no investigation needed. He wants to hear that. He gives me follow-up money only for this. That I
Hmm.
say this one word. Nothing has happened to you. That's it. The moment he really gets it, he goes.
ऐसे पेशेंट हमको भी मिलने चाहिए, सबको मिलने चाहिए.
But
और लिटरली आई एम टेलिंग, आई एम नॉट एग्जैगरेटिंग, उसका फॉलोअप 3 से 4 मिनट से ज्यादा रहता नहीं है. 3-4 मिनट ही विल टेल हिज स्टोरी. व्हाट डू यू थिंक डॉक्टर? दिस इज बस. हाँ, दैट इज वन मोर. द पॉइंट इज one more symptom of column 2 of periodic table is desire for assurance.
Reassurance.
assurance.
They really like that somebody assures them, ha, I am with you, nothing has happened, I have assured you, nothing will happen. That is
Hmm.
again second column, which is calcarea, assurance, desire. So I thought
Hmm.
I will add things. That's it from me.
Hmm. Hmm.
Nice, very learning session. I would just like to add, I had maybe a couple of patients. ये जो rage type of anger is very peculiar of Hiparsal. Both my patients also had it. I
Hmm.
remember my patient was almost 72 or 75 years of age. And because of his profession, he was so strong even at that age that his son couldn't control him. He used to just move his hand like that, and the sun used to go 8, 10 feet away. Itna strength tha. And with that kind of strength, he used to hit his wife when he got angry. And the wife was like that, ekdam meek. So
Hmm.
that kind of anger. And I
Hmm.
remember in that case also there was one thing which the daughter shared with me, that he would never take them on a trip. He was in
Hmm.
railways, and he would get a free trip, free pass for the whole family every year, but he would never take them on a trip in spite of it being free. And the reason he gave was, what if we go there and there is a bomb blast over there? So if fear, one fear, which is also calcaria, but fear of bomb blast, that was very
Hmm.
specific in that case, and it was also hepar sulf. The other thing that was characteristic in that case was very abusive language.
Hmm.
Even within on video, he at the age of 70 to 75, he used to use abusive language, and straight off like mother sister type of language.
Which we cannot say on live.
Right. But
So
usually this is also one characteristic Vitulkas has mentioned, that
yes,
aggressive, abusive. These are
yes,
the
yes,
two
yes.
words he has highlighted for Ipar.
That is one thing. And one more characteristic which I think we have not yet spoken about is amusement aversion for. Hipar is
Hmm.
one of the highest remedies in this rubric. If you see, Hipar and Ignatia are the two remedies. The
Hmm.
other
Hmm.
case that I had was of a girl who was on crutches for almost 2, 3 years. It was a very simple thing. She fell down or she had some injury, she had a fracture, and that never healed. And she got on crutches, and then it was very, life was difficult for her. She must have been just some 18, 20 years of age, but because of family situation she had to work, she had to go on a job, and that made her so irritable. Okay, I cannot complete my studies, I cannot do this, I cannot do, just because of these crutches. And she gave me this symptom, amusement aversion. She was so sensitive to it that even if her family members are watching TV, she used to get very angry. She must have broken 4, 5 remotes, TV remotes, because of that anger.
Hmm. Hmm.
So that's an important symptom I remember for hepar sulf, other than of course the chilliness and the other symptoms which we talked
I
about,
think we
the
should talk a little bit
suppuration.
about the pus also, because it's a one
Yeah, I was
remedy
just
that
Right. So
is very known for pus and also prostate.
prostate. And when you said that patient, Shrikant, you were the chilliness and suppuration. So one thing came in my mind, silica could be the possibility. But you shared the assurance thing afterwards. But silica also close in chilliness also, as well as in suppuration,
Yes.
very close to Ipar.
Yeah, and we differentiate it with calcarea sulf because
Hmm.
calcarea sulf also has pus, but it's hot. Hepar is chilly.
So one thing what I understood is how I understand calcarea self and Hepar self. So calcarea self, I understand Hepar self is intensified calcarea self, heightened or intensified. One thing, and for the pus, as we all know, calcarea self, when pus has found the vent, and I
Hmm.
have seen the case of calcarea self. One boy it was my student's case, and he was having a boil on chest. So he developed boil burst open, the pus drained out, but after that it did not get healed, and there was continuous oozing of discharge, serous or pustular discharge from boil. And we gave him calcareous sulf, and he that wound got healed after hip calcareous sulf. So calcareous sulf is typical that when pus has found the vein and it is oozing, it become chronic process, it is not get healed. So that is very interesting, what I found for calcareous sulf, which is in heparsal we see the process when there is a redness, tenderness, touch sensitivity, extremely painful situation, hot red, the active inflammation stage, and the suppuration is also there with. with
Yeah, I
what
think now that you talk, I remembered one more thing is Hipparcell generally is very oversensitive,
Hmm.
very touchy, no? Slightest draft of air, slightest, even other senses like noise, smell, odor, they are very sensitive and they
Yes.
can be really affected by all these sensory stimuli. While the cold air predominates, but it is equally sensitive to noise, taste, odor. It's a very
Hypersense. Yes. H for
hypersensitive,
hypersel,
heightened
H for
sensitive. That is why
hypersense.
it is so irritable. The slightest, I think it is also there in contradiction,
Yes,
aggravation, like
Yes. Yes,
even
sir.
Kent mentions that yeah, it is very difficult to be with a hippocampus because you will never know which word of yours actually hurt him, and he will
And
just go into a rage.
like he
so.
has
That is what
desire
you
to
see.
kill,
That is what you
desire to
see.
kill person who has offended.
No, that is what we see in Dr. Shardul's case, where the slightest thing that why are you seeing mobile, eat your food, that also is like now I
Absolutely.
will break. And
Explode.
so extreme high sensitivity, and it's also another way of looking at that is contradiction
Aggravated.
intolerant of. They
Intolerant. Yes.
cannot take contradiction. You don't do this.
Hmm.
Why are you doing this? Let
Hmm.
us do it this way. They will not take. When
Hmm.
you see this kind of reaction, when someone is told, don't do this, and then they are not able to take it, it's one of the rubric that we should consider is contradiction intolerant of.
Absolutely.
Yes.
Nice. I think this is a
Yeah, Devang, if you
very
can
long way.
contribute on pus remedies a little bit more, or any other,
Well, in Hipar self, I have seen that sourness is important. The discharges are sour, and there is also a desire for sour things. It is one of the important remedies for desire for sour things. In
Hmm.
terms of pus, of course, it's very clear. Hipar self is before the pus has found vent, and the point is it's very sensitive. And in calcarea self, as Dr. Shardul mentions, that when the pus has found vent, so we have the three remedies: mercury, Hipar self, silicia. And then one remedy that we can think of when everything fails is myristica, which is also a important pus remedy. Myristica or myrica. Let me just
yeah,
check.
can we give real indications? When will you give
Myristica.
silica? When will you give Hipparcell? When will you give mercury? If we can differentiate, I think it will be more helpful.
It is very easy for Hipar self and silicia. If the pus has already come out, it is very clear that you have to give calcarea self for me.
Hmm.
When the sensitivity is extremely high of a boil, that you have to see when you examine the patient, that scores higher for Hipar self than silicia. It is difficult to differentiate between Hipar self and silicia. The differentiation is more when you try to examine. For silicia, mainly the boil is worse by pressure, and in Hipar self, the boil is worse by touch. And when you have given Hipar self and silicia, still the patient does not improve. One remedy to think of is myristica. If
Hmm.
you can look in boric, is said to act more powerfully than Hipar self and silicia.
Yeah,
Then
but Devang, is there any case that you can share? Thoda, matlab
myristica, to I
uh,
don't have, but I know this indication of myristica. When Hipar self and silicia fail, you
Okay.
can think of myristica.
Hmm. Hmm.
septic powers, antiseptic powers, inflammation, cellular tissue periosteum.
Especially around the fingernails, panericium,
Yes.
that kind of
Hmm.
a condition.
Nail infection. That is what I have also seen myristica. That when there are
Fortunately
nails
for
in,
me, Hipar self and silicia do the job for me and patients improve. So I haven't had the need to use this remedy. But it is important to know that in case in future, if these remedies fail, then the patient should not go here and there, and you should have myristic at the back of your mind.
hmm.
Yeah, just
Well, very nice.
one remedy that came to my mind, especially because we read about septic conditions. Myristica is for septic conditions, eh, um, and also because of my specialty, which is cancer. One remedy where you see destruction, where there is destructive tissue. It can be gangrene, it can be cancer, it can be necrosis. And in that necrotic dead tissue, if you see lot of pus formation, the first remedy that you should think of is gunpowder.
Yes.
Gunpowder, when there is gangrene, when there
Mm,
is destructive necrotic tissue with lot of pus, and there the patient will especially focus on, I feel, if this thing bursts, no, this big tumor that has come, if it bursts open and if it all this pus or inflammation comes out, I'll get better. They
mm,
really feel I'll get better. बस ऐसे क्या फूट जाना चाहिए, or it should just burst open and everything should come out. It's not coming out. It's only increasing in size. So please give me something that the size reduces, and then I'll be okay. The others say it is cancer, but I don't think it is cancer. I will get better. Huh? So somehow gunpowder, I think, is a little bit of a positive remedy, even if there is such kind of grave pathology like gangrene and necrosis and cancer going um, around in the
like
bank.
sulfur, we see sulfur also has this kind
Yes,
of
yes. Ah,
hopefulness.
ah.
Okay.
Gunpowder has to have some blackness from whatever
Ah,
I have learned
yes.
from teacher. If there is no blackness, there is no gunpowder. Like
Mm,
Yeah.
graphite is. So blackness without abscess is graphitis. Blackness with boils or abscess is gunpowder. This is how
Yeah.
I
So
remember.
what Dr. Devang is telling us is how the gangrene will be seen on examination. On examination, you'll see a lot of dead tissue, which is seen in the form of blackness. When there's a
mm.
lot of dead tissue, you'll see more and more black, offensive, putridity, all of
Necrotic
this.
area,
Ah,
gangrene. Mm, mm.
so I think the examination of things will definitely help in differentiation.
Yes. Good.
Okay, anything else?
No, I think we can conclude today's session. So that it was a good discussion. So we could
Uh,
learn so many things about HEPA self, so many new things, maybe revision of the whatever we know. And right, this is how we increase, we develop our knowledge, we develop our ideas, how to approach the case, how to see the remedies, how to differentiate. And what we saw, the hypersensitivity at every level of paper self, not only at physical level, but how generally he is hypersensitive at mind, emotion, and body. So this is how we learn the remedies. And this kind of discussion helps us to develop the ideas to be better homeopath, be better person. And we intend to continue this discussion, this session, this series every month. So this time we met on second Thursday, but we are thinking of meeting every the first Thursday of every month. So let's hope we will continue this discussion. And please give your feedbacks, please give your ideas. Any topic you want to discuss, you can suggest, you can comment, you can write in comment. So we will definitely think about it, we will definitely do that also. And keep watching these sessions, and keep growing as a homeopath and as a person. So thank you.
Okay,
Okay,
everyone. Bye
okay.
bye.
Thank you, Dr. Shardul and everyone.
Yeah,
Thank you,
bye.
everyone. Bye.
Bye bye.